the year that you've committed to becoming a better you, plastic surgery might be something you've thought about. In particular, breast augmentation. Here to tell us more this morning is Dr. Vincent Voci with Voci Plastic Surgery. Dr. Voci, we love having you here. Thanks so much for coming today.
Oh, thank you, Colleen, for the invitation.
All right, there are many different reasons that women consider getting breast augmentation. You've been performing this for many, many years. Right. The first one you want to talk about is small breasts. A lot of women come in because they're not happy with the size of their breasts.
Yes. A woman's figure a feminine figure is very, very important to her. And the female breast is a very vital part of that. And the most common reason for improving the shape of a woman's breast is they're too small. And that can be congenital. That can also follow weight loss, pregnancy, and just life in general. But the most common is just being born with breasts smaller than what you like. But sometimes they're too big. I mean, you have breast reduction. Sometimes they just need skin tightening. That's called the breast lift, with or without implants. There's all types of combinations depending on the patient's desires and anatomy.
Or restoring the fullness, because as you mentioned, after pregnancy, after breastfeeding, the breast can change. Talk about breast augmentation and how it's performed, because I think for some people that might be sort of a frightening thing, but it's such a common procedure.
Right. It's the most common cosmetic operation in this country. Probably almost 500,000 people every year have breast augmentation in the United States. And in our office, we have a very beautiful, very private, fully accredited surgical suite, board-certified anesthesiologist giving the anesthesia. And it takes about an hour and a half, sometimes a little bit less, sometimes a little bit more. The recovery is fairly quick. Within 5 to 7 days, patients are back to work, unless they have a real physical job.
Right.
Pain, it's just under the muscle, there's some muscle discomfort, but after a couple of days, that's not bad. On top of the muscle, the implants don't hurt at all.
Talk about the different types of breast implants. What should we know about that?
Well, there are two general types, and that's one saline filled and one silicone gel filled. They come in different sizes and different shapes, and the gel implants come with different consistencies also.
We're looking at some here. These are actual implants that you brought in today.
Yes. We choose what's right for that patient. Or if the patient has a desire, we talk about what's right within those desires. But there are many choices depending on the patient's desires and their build.
What's the most common?
In the United States right now is silicone gel.
Okay. When you say that, you talk with patients about what it is that she wants, how do you help them figure that out? I mean, you talk about their wants and their needs, their desires. If someone wants a more natural look, you can achieve that.
Yes. And it's listening to the patient. And I spend a great deal of time listening to the patient to decide what they want, and is it within the realm of their anatomy.
Look at that.
And discussing, talking to the patient, understanding what they want is critical, and I spend a lot of time doing that. There's a very natural result there that the patient is very pleased with. Sometimes the patient will also want a more athletic look.
Talk about that, yes, because they don't want breasts that will interfere with athletics or working out, right?
Yes, and so it's totally flexible, again, depending on their anatomy as well.
Again, there's another after picture. We should mention, too, Dr. Voci. Yeah, go ahead. Would you like to say something about that?
That just shows the perfect figure. And a lot of times we'll combine breast augmentation with liposuction, sculpture, cool sculpting, tummy tuck. It all fits on one body.
Yeah, you combine all of those to really help your patients achieve the desired look that they want.
Yes, and it can be done at the same time or different times.
Sort of mommy makeovers, but you don't have to be a mommy to get one done.
Sometimes you don't have to be.
That's the truth. You have a New Year, New Figure special. This is great, everybody. You can save $500 to $1,000 right now.
Right now, yes, and this is for a limited time. But now's the time women are thinking about their figure coming up for spring and summer, so that's why we're running this special. And it's gel, saline, just depending on what they want and what they need. We have a special for everybody.
Yeah, now is the time to do this, to be ready for spring and summer. It's a great offer. It's a great offer. And he's an excellent doctor. Call Voci Plastic Surgery. The number is 704-333-8300. I'll say it again, 704-333-8300, or you can visit the website. It's vociplasticsurgery.com. That's VOCI plasticsurgery.com. If you go to Dr. Voci's website, there's a gallery of photos if you want to see more pictures of work that he's done. It's fantastic.
Thank you. Thank you, Colleen.
Yeah,
thank you very much.
We love having you here. Thank you so much.
I enjoy it.
All right.